Okay, so next topic in the subject supervision is types of supervision and steps of supervision. These two subtopics we will complete in today's class. Okay. So when we discuss about types of supervision, basically we have only two types of supervisions. What are those? Direct supervision and indirect supervision. Simple. Okay. As the name suggests, direct means directly we are observing the client. Okay. If for example ANM is working in the clinic and the supervisor just sitting and supervising how she is performing the activity. Okay. And even in hospitals, when a staff nurse is doing nursing procedures or nursing service, then supervisor visits the ward and just observe how she is doing. That is known as direct supervision. So what is this direct supervision? This is done through face-to-face talking with the workers. Okay, observing and talking. Okay, discussing with them. This can be exercised in the wards, in the hospitals, PHC, sub-center, and in the community as well. Okay, so direct supervision can be done in any setting, be it hospital, sub-center, PHC, okay, by talking or only by observation. Okay. Then the following considerations are essential in direct supervision. During direct supervision, the supervisor should keep in mind some points. What are those? Number one, do not lose temper or abuse. Okay, because when we are directly with the client, observing and discussing, some other people will also be there. So in front of them, we should never shout on the subordinates. Okay, so do not lose temper. If he or she is making mistake, then even you can stop her, and later on you can tell that what was the problem. You should not do this, but should not shout in front of the public. Okay, so do not lose temper or abuse. Then use democratic approach and avoid autocratic methods. Okay, do you know what is democratic method and what is autocratic method? Democratic means just indulging the subordinates in friendly way. Okay, and autocratic means just an authoritarian and shouting on the subordinates. Okay, so you should be democratic. You can ask some ideas from the client or the subordinates. So that system is known as democratic. So the supervisor should be democratic during direct supervision. Reprimand if necessary in private, do not it promptly. Okay, do it promptly. What is that? That if a client or the subordinate is making any mistake, then as I just told, that in private or in your room, when you and the subordinate is there, then you can tell, or even you can shout, but not in public. Okay, depending upon the mistake he or she has done. Okay, in this way the direct supervision will be effective. Okay, and even your subordinate will trust you. Okay, that you are doing proper things, you are supervising properly, and you are not finding the faults only, you are trying to correct him or her. Okay, so these points should be kept in mind while doing the direct supervision. Then in direct supervision, give workers a chance to reply. Okay, if she has made some mistake, then let him or her to explain what was the condition during that time. Okay, listen to them. Okay, do not talk too much or too fast. Okay, when you are supervising, you should speak in such a way that the subordinates can understand what you are saying. Okay, so do not speak very fast. While giving instruction, you should speak clearly. Then be human in behavior. When you are discussing, when you are talking to subordinates, be human in behavior. Okay, your behavior should be good towards your subordinates. do not take it granted that the worker has understood everything told to them. Okay, if you are speaking someone, you should not understand yourself that the subordinates has understood. Get some feedbacks from the clients that they have understood or not. Okay, because when you are supervising someone and you have given some task, but the students or the supervisee have not understood what they have to do, then they will definitely make mistakes. So you should be clear in your mind that yes, they have understood. So you can ask them questions related to that and take feedback that what you have understood by this activity. Okay. For example, we can say that if you have given a task to your subordinates or to whom you are supervising, that we have go for survey. Okay. So what is the survey, how you will do survey, and what is the pro forma, everything you should tell them ahead. Okay. Then do not give instruction in haphazard way. Okay. Every instruction should be very clear, point to point. Okay. So that they can understand properly. Clear? So keep in mind that when you are supervising, you also have some responsibilities. Okay. So accordingly, you have to do activities. Now we come to second type of supervision, that is indirect supervision. What is indirect supervision? During indirect supervision, we are not directly discussing or directly in contact with the supervisee, but we are supervising through discussing with other team members or checking their record, what they have done. Okay. And even discussing with the patient to whom you have provided services. By this we can check. Okay. So it is done with the help of records and reports made by the workers, and through some written instructions, through some agency between the worker and supervisor. It means you can ask some third party person that how they are working. Okay. And sometime even by giving some questions, like we are doing here in our classroom. Okay, we give you some test. Okay, give some question, you will write their answer. So in this way we can supervise you that how you are performing in the class. So these system are the indirect supervision. Okay. Then the example of indirect supervision again in the ward, when we are supervising the staff nurses in the ward, how we can supervise indirectly? By checking the patient's record and the reports, case studies, by doing case study, journal order book, round book which is maintained in the wards, medicine ledger book, call book, procedure manuals of the staff, nurses notes, nursing care plans, and other records which are related to that institute. Okay, this may be in the wards as well as in the health centers. Okay, so we can supervise indirectly. The example of community health setting, the example will be tour diary schedule. Okay, when the staff nurses or the ANMs are making the registers, those registers are known as tour diary. Means whenever they are going for some village tour, they will enter in the that register. Okay, so that record can be observed by the supervisor, work diary, their performance report, MCH cards maintained by the ANM. Okay. Then eligible couple register, monthly reports, and all other reports related to that sub-center or PHC. Okay. By observing these, we can indirectly supervise the client. Indirect supervision also involves some points that should be kept in mind. Number one, we should ensure that every worker is carrying out allotted work in accordance with the plan of operation with prescribed methodology and keeping pace with the time as possible. So whenever we are supervising through records, we should see that records are maintained as per the performa accepted by the authority, that the subordinates are making the reports in proper performa or not. If they are not making in proper performa, then we can ask that you should make your reports as per the performance accepted by the institution or the authority. Okay. So in this way we can check that how they are doing their work. And when they are doing some activities like in the register maintained, then the columns in the register should be as per the accepted norms. Okay, they should not add or remove the columns as per their need. Okay, they should be again accepted by the authority. Okay, so in this way, if their records are maintained properly, then you can give them good marks in the supervision. Otherwise, you can ask them to improve. Okay, so this is indirect supervision. Apart from this, we can also check the monthly progress reports maintained by the worker and the achievements when they are providing the services. Analyzing what amount of work allotted to the client for the month and what has been done. Okay, so we can also see what targets were given to the client and what they have achieved till now. So through these points we can supervise indirectly. So one question we can complete here, that what are the types of supervision. Okay, 2 types and some explanation will be sufficient. Now second question appears, what are the steps of supervision. Okay, overall supervision involves some steps. So according what will be the steps? Number 1, definition of the job to be done. So whenever supervisor starts supervision, first of all he should clear or he should define that what is to be supervised, what activity is to be supervised. So that is known as the definition of the job to be done by the subordinates. For example, if you are going to supervise ANMs in the center, then you can ask about all the clinics run by the ANM. We will check. It means immunization clinic and MCH clinic, that we will supervise. Okay, so clearly define that what you are going to supervise, what activity you are going to check or supervise. Then selection and organization of supervisor's activity. Okay, this is done by the higher authority, means manager. Okay, he or she will first clearly explain that what will be the supervisor's responsibility. Okay, that will be told to supervisor. Okay, so selection and organization of the supervisor's activity. Now anticipation of difficulties. Some points are to be finalized, that what possible problems will be there during supervision. Okay, on the part of supervisor, on the part of staff, in relation to time, in relation to the condition of the roads, how the supervisor will reach in the villages, okay, how the worker is going to the villages. So everything should be kept in mind before planning the supervision. Okay, then establishment of criteria for evaluation. Then we plan some criteria, that on what points we will supervise and how we will give the markings. Okay, so like we are making some checklist. In this way we will prepare some criteria for the evaluation. Okay, for example, if we are supervising immunization clinic, then we will make some evaluation points. For example, the ANM is properly maintaining cold chain or not. If yes, then we will give full marks. If she is not maintaining, then we can give the less markings, and how she is maintaining, then we can correct it. Okay, so in this way we will make some points on which we will evaluate or supervise the subordinates. So then we will establish the criteria. After that, these 4 points can be in relation to the supervisor as well as in relation to the staff to whom we are supervising. Okay, so first we will define the job and explain clearly to the subordinates. Okay. The definition of job require understanding the general and specific objectives, that what we have to do. Okay, general objective, main activity, and then specific objectivity, as you have seen in the your health talks. Okay, so these should be clearly defined in relation to the activities. Then I have already told you selection and organization of supervisor's activity, means what supervisor is expected to do. Okay, and these are written or clearly find out by the managers, okay, who is assigning the work to supervisor. Then again, as we have discussed, anticipation of difficulty related to service problems, administrative difficulty, personal factors, resource availability, poor relation, as I told that if there are the roads are not good, how he or she is reaching to the center. Okay, in these points we should also write, or we should keep in mind while supervising the client. Then again, the criteria, establishment of criteria, like what are the goals, what points we will check, what activities we will check, and what are the main points accordingly on which we will give the markings to the subordinates, that we will decide. So these are known as the steps of supervision. Okay, so you can write just, if the marks are less, then you can write just their headings, but if marks are more, then you can write some explanation. You can also write in your language, okay, just writing the heading and explaining your language. Okay, thank you.